Hello again, John Muir and Joan Evans back with another week of communication skills. This week is going to be our first session in the Learning Resource Centre on Barrington Street. This session is the first chance that all the students get to interview a patient. This is going to be a very heavy session for them. They get very tired during this session. Quite emotional sometimes from the students, not from the SPs or anyone else. And they certainly feel very exhausted at the end of this session, but it's one that they really value. So it's a great session. And so go into a little bit about it. The session itself is going to be divided into essentially three parts. There's a tutorial at the beginning, then there's a set of interviews whereby students in pairs see four SPs, four cases. Each student gets to interview two cases, each student gets to observe two cases, and you as a tutor get to see each of your students interviewing one case. Mm-hmm. Then after that interview session is over, we have a closing session, and that's to allow some debriefing of the students, some reflective thought on what they've learned, things that they've seen, and just to calm the session down afterwards, because as I say, they find this quite
stressful,
and emotional session for themselves.
Yeah. Okay, so this is really about getting a chance to actually practice the skills that were introduced, in the first week. That if you were a Tuesday tutor, you may not have met your students, so they have actually practiced with the Thursday tutor who was covering for that day. So this could be your first opportunity to meet your students as well. And again, to discuss in your first tutorial, you've got that 45 minutes. Again, any questions, any concerns about introducing yourself, how you would start, the kinds of questions that you're going to be asking, the structure of the interview, how you would close. So just review those things so that you're reassured that your learners are organized as well.
I certainly have found it often useful to get the students to pair and go with the other person and introduce themselves as they plan to introduce themselves when they go into the room. Because often when they start the interviews, they walk into the room and they freeze because they haven't thought about what they're going to say. And if they've had a chance to do that beforehand, at least that piece isn't lost. It's just a useful thing to do, as well as you said, reviewing, closing, reviewing some of the questions they may ask, reminding them about open-ended questions, although at this stage they don't necessarily have much medical knowledge. So they're less likely to ask content questions. But we do see students with medical backgrounds of various types and health care backgrounds of various types who do know some of the content, and you often have to try and prevent them going straight into content because what we're trying to teach here and look at here is the process of the interview and those very important skills that they need to develop in interviewing.
Exactly, and at this point that's safer territory for them, but they don't feel it's as important because they know they need to be asking questions that zero in on the medical condition. So one of the patients presents with a headache and is concerned about the headaches. So some learners will ask a lot of questions about when the headache started, how long they've lasted, which is okay, provided they also ask those questions, however, that are open-ended. So to ask the question, and can you tell me what brought you into the office today? First open-ended question invites the patient to tell their story without interruption. And then to actually work from what the patient is telling you. Now, what we know at this level is that learners are stressed and they're often not hearing. They're just repeating a script, which is okay. It's part of the way they learn. And they'll be quickly moving into more active listening. But to encourage the learner to ask those open-ended questions.
And particularly the five
questions.
To repeat the five.
Yeah.
What are you feeling? What ideas what do you think is causing this? What are your expectations for this visit? Mm-hmm. How is this affecting you as a patient? What's the function?
Exactly. So, for instance, the patient who presents with a headache, her concern, if it doesn't get elicited in the interview, it'd be unfortunate. But her concern is that someone that she knows was diagnosed with a brain tumor and died. So she's fearful that she may have a brain tumor. So now that's very important information. So that if that doesn't come out in an interview, then that patient's need was not necessarily met. And very important information was not elicited in that interview. Okay?
So in the interviews, as I said, there are going to be 4 interviews, 2 with each student as interviewer, 2 as observer. We allocate 12.5 minutes of time for the interview. It is very unusual in this session that the students fill that 12.5 minutes. I would suspect most of them will have difficulty going on beyond 5 or 6 minutes. That's okay. And if some may even be much less than that. That's okay. Then it's often useful to stop them, to time out, say stop. Where are we getting into problems here? Have a discussion. You can always restart the interview. And you can even restart the interview after the signal that the interview's ended. If you've been discussing it well in advance, you can keep going back into it.
Exactly. And don't forget that you've got a peer observer in the room whose function is to observe and provide feedback. And that peer observer should be encouraged to take notes. They should have with them their Calgary-Cambridge guide checklist to the medical interview. They're only using the process skills at this time. That checklist has content skills on it as well. But encourage your learners to use it as a guide at this point. And what you will find is that learners provide very, very good feedback to each other. So after the student has actually finished the interview, again, we talked about order in our first larger group session, but now it's a little different. We're going to ask you to ask the learner who was the interviewer to self-assess, how did it go? And you want to get balanced comments, things that were effective and less effective. Then ask the other learner in the room. We want the learning to be about the two students. So the peer gets to comment, then go to the SP. What we found in previous years is if we went to the SP before the peer, then the peer didn't have anything to add. So in this case, it gives the peer something to offer rather than just build on somebody else's comments. Okay, so the actual interviewing then, as John said, 4 interviews rotating through. LRC staff will guide the students. After the interviews, we're going to move into the closing tutorial.
Just before it, you will almost certainly see an improvement across the course of the day. You're going to be seeing 4 different students. Often we're sitting in the video room and we're able to look into rooms. And if you look at the same student, the same student's second interview is often very much better than the first interview. Just because they've been there, they've done it, they've less stress on the second one, they do a lot better job. That we can actually see that much of a difference just between 1 and 2. Unfortunately, you don't get to see that quite the same way because you're seeing a different student with each one. But you'll probably see that students sequentially improve across the...
Yeah, and that's actually very heartening, and you'll see it week to week as well.
Very definitely. Yeah. The second LRC session, it's just almost totally different group. They really are absorbing the stuff really fast.
Yeah. So in your closing interview then, this is your opportunity as well. If you've noticed challenges across your students, if you've noticed questions that got raised that you couldn't fully explore because the buzzer was going off, these are opportunities for you to raise these things again in that last 45-minute tutorial. And to also review how patient-centered those interviews were by asking the questions that we've provided for you in the manual online, which is you can ask learners, was the patient's perspective understood? First of all, was it elicited? So for instance, for the woman who presents with the headaches, was her perspective, were her fears actually learned? Okay, that's important. Was the reason for the patient's visit to the doctor learned? Sometimes it never comes up. The patient often doesn't give the real story when they're first asked. They might need a bit of encouragement. Were the patient's expectations of the visit met? And learners are often very black and white at this point, so they may just ask, and what are your expectations of the visit? That's one way of asking it for sure, as opposed to, and what were you hoping we could do for you today? So see, that's where your experience could help those learners rephrase and incorporate into their own language and personality as well. And were the patient and doctor's agendas or concerns similar? Okay, so those are questions that can guide your discussion, and you can actually plant them in your introductory tutorial so that learners can be thinking about those.
And it's important in this session as well, on this closing tutorial, to elicit what the students feel about it, to make them reflect on what they've been doing, ideas that they've come up with, things they've learned.
Yes.
And in fact, it's important to do that after every session, really.
Yeah.
But this one particularly, what did you learn? What are you taking away from it?
Yeah, and that can be done in what we call a round robin. Ask each learner, when you go around the group, to talk about one thing that they learned in those interviews today. That way, even your quiet student will have an opportunity to contribute early in that post-conference. Okay?
Okay.
Okay, well, thank you, and we'll move on to our next discussion. So.